Hello friends, welcome to Master Nurse. Today, as a part of Jipmer Norcet preparation series, we will see an important aspect. So we usually see question and answers. So we'll see one example question and then move on to the topic. So the example question is Charcot's neurologic triad, which includes nystagmus, intention tremors and dysarthria, is a classical symptom of dash disease. The answer, multiple sclerosis. So why I have given this question is, this Charcot's triad is a syndrome or a collection of symptoms. Okay, so this kind of questions are very common in Norcet and Jipmer exams. They will give you a classical symptom of some disease and they will ask you which disease has this classical symptom. So now in this example, if you see what is this Charcot's neurologic triad. So this includes nystagmus, which is caused by damage to the nerves, optical nerves. Then there will be intention tremors. So intention tremor is nothing but when they reach out to touch an object or when they try to do some activity, only then the tremors will be increased. And the next one is dysarthria, which is disturbed articulation of words. There will be difficulty in articulating words and speaking because of damage to nerves that supply to the facial or speaking muscles. So this disease is a classical symptom of multiple sclerosis. And this disease was given by, these symptoms were given by Jean Martin Charcot 115 years ago. That's why it is named after him. So this is an example question. So now we'll see directly the classical symptom and the disease. So question number 1 or the example number 1 is bronze-like pigmentation. Bronze-like pigmentation in the skin is seen in which disease? So if we see, the answer will be Addison's disease. So basically Addison's disease is an endocrine disorder. Here there will be adrenal insufficiency and there will be decreased cortisol and decreased aldosterone. So what happens here is the levels of melanin are affected and that causes hyperpigmentation, and this causes a shiny skin which will be giving you a bronze colored appearance in the skin, and it is common in Addison's disease. So bronze like pigmentation is seen in Addison's disease. Number 2, spider angioma. So what is this spider angioma? So spider angioma is a symptom where you will see dilated arterioles. So the blood vessels, arterioles will be dilated, it will become reddened and it will be seen in the superficial part of the skin. It will be seen in a cluster. So it will give it a spider-like appearance. So it will be like a spider in appearance. It will be reddish and it is also called as spider nevus. So this is commonly seen in liver cirrhosis. This is caused because of increased vascular endothelial growth factor. Next symptom is a combination of two symptoms. One is raccoon eyes along with battle sign. So what is this raccoon eyes? It is otherwise called as periorbital ecchymosis, which means there is dark purplish bruises or discoloration seen around and under the eyes. The second one is battle sign. So again same here, there will be bruises and discoloration behind the ears. It is also called as retroauricular or mastoid ecchymosis. So there is ecchymosis around the eyes and behind the ears. These two conditions are commonly seen in which disease or which issue? If you see, the answer is basilar skull fracture, which means if there is a fracture in the base of the skull which involves temporal bone, ethmoid bone, orbital plates, etc., it will result in these two symptoms, the raccoon eyes and battle sign. Number 4 is again a combination of two symptoms. The first is moon face along with buffalo hump. So where you will see this? Moon face is nothing but a round shaped face, and buffalo hump is there will be a swelling kind of picture seen in the back. So this is caused in a condition called as Cushing syndrome. So what happens here in Cushing syndrome, there is high levels of cortisol circulating in the blood. This high levels of cortisol can disturb the distribution of fat in the body. So what will happen is there will be abnormal accumulation of fat in the face and abnormal accumulation of fat in the back. So it will cause a buffalo hump on the back and a moon-like or rounded face. So these two symptoms are commonly seen in Cushing syndrome. Number 5, owl's eye appearance of a cell is seen in which condition? So owl's eye appearance in a cell, which is a microscopic view of a cell, when you see it, it will look like owl's eyes, which means there will be two cells with nucleoles enlarged, kind of owl's eye like picture as shown in this image you will see. So this is common in a cytomegalovirus infection. So what will happen in cytomegalovirus infection is the virus inclusion, the particles of the virus will get accumulated in the cell, making the cell look enlarged and giving it an owl-like eye appearance. So similar kind of appearance will also be seen in another disease where the cell is called as Reed-Sternberg cell. So you should not get confused. There is another thing called as Reed-Sternberg cell. Same owl-like appearance will be seen, but the difference here will be in Reed-Sternberg cells, the enlarged portion will be the nucleolus of the cell. But here in cytomegalovirus infection, the enlarged part is not the nucleus, it is the viral inclusions. And another difference is that in Reed-Sternberg cells, the nuclei will be seen, it will be in blue in color. But here in CMV viral infection, it will look in pinkish shades. Okay, that is the difference. So owl's eye appearance is commonly seen in cytomegalovirus infection, also seen in Reed-Sternberg cell. Reed-Sternberg cell is a symptom that is seen in a disease called as Hodgkin's lymphoma, a type of cancer. Okay, the next one is Hohmann's sign. So what is this Hohmann's sign? It is a commonly seen in DVT. Okay, so to make sure that a patient has DVT, this Hohmann's sign assessment is done. So how this assessment is done? This is done by holding the legs of the patient straight when he is sitting or lying and dorsiflexing the foot. So the foot is flexed backward, dorsiflexion is done. When this is done, if the patient is complaining of severe pain or showing any resistance, it means that it is positive Hohmann's sign. So positive Hohmann's sign is an indication of deep vein thrombosis. The next one, 7th, is acetone breath. What is this acetone breath? Acetone breath is nothing but a sweet smelly or sweet odor from the mouth. So what is this acetone? Chemically, this acetone is dimethyl ketone. It is a ketone, and this ketone has a characteristic of sweet taste, and the smell will be like a decaying apple. So there will be slight sweetness and some pungent smell will be there in a decaying apple. The similar smell will be seen in dimethyl ketone, that is acetone. So when this happens is when the body is utilizing fat, when body is utilizing the fat for energy, there will be increased production of acetones. This process is called as ketosis. When this happens in a patient with diabetes, it leads to increased content of ketones in the blood. That leads to a condition called as diabetic ketoacidosis. Only then this acetone breath will start coming out. So acetone breath is a classic symptom of diabetic ketoacidosis. Next symptom is tunnel vision. So what is this tunnel vision? In tunnel vision, what will happen is when a person is seeing, the edges, the sides and the corners will be either blurred or it will become dark. So they will not be able to see what is in the side and what is on the corners, edges. They will only be able to see what is in the center. So if they are looking at a faraway building, they can't see the sides of the street. They can see only the center of the building. So this kind of condition is very common in glaucoma. So tunnel vision is very common in glaucoma. It is also seen in other conditions like migraine, retinopathy and stroke also, but it is very common in glaucoma. Why it is very common in glaucoma is, so we all know that glaucoma is a condition where there is increased intraocular pressure. So what happens during this increased intraocular pressure is, if you see parts of the eye, between the lens and the cornea there will be a small gap. This gap is called as aqueous humor. Inside this aqueous humor there will be a fluid called as aqueous fluid. So what will happen is, this fluid is responsible for maintaining the shape of the eyeball and the surrounding structures. So usually the fluid will get drained by a meshwork or a tubular system in the eyes. In glaucoma what will happen is, this tube will get blocked. So there will be abnormal collection of this aqueous fluid inside the eyes, leading to intraocular pressure. Because of this it will lead to something called as peripheral vision loss, which means the outer side of your eyes, you cannot see what is there in the sides of your eyes. You can see only the part that is straight to you or which is in the center. So this condition will lead to tunnel vision. Symptom number 9, strawberry tongue, is a symptom that is commonly seen in Kawasaki disease. So what happens in this strawberry tongue is, the tongue becomes fully reddish in color and there will be white spots on the tongue, giving it a strawberry like appearance. So what is this Kawasaki disease? The Kawasaki disease is a disease of children with unknown cause. There is no cause identified for this disease, but there will be inflammation of blood vessels all around the body. So when there is this inflammation of blood vessels around the body, tongue is a very delicate part. So what happens during the tongue is, the inflammation becomes very severe and giving the tongue a strawberry like appearance. So strawberry tongue is seen in Kawasaki disease. Number 10, butterfly rash on the face. So what is this butterfly rash? So there will be a butterfly like appearance as shown in the image. So it will be seen on either side of the nose, that is on your cheeks, below the eyes and on the nose also, giving the butterfly like shape. This is very commonly seen in an autoimmune disorder called as systemic lupus erythematosus. So butterfly like rash, answer is systemic lupus erythematosus. Number 11, CHIKMUNK cheeks is a symptom that is commonly seen in bulimia. So what is bulimia? So bulimia is a disorder where the patient eats more. They will not be able to control their binge eating, so they will eat more, but after eating more they will feel that they have eaten more. So here sometimes what they will try to do is, they will try to purge, which means purging means trying to bring out all the food that they ate. So they will either do it with the help of vomiting, or sometimes they will take some diarrhea inducing medicines to induce diarrhea. So most of them what they try is to vomit it. So for vomiting what they will do, they'll either take a vomit inducing medicine, and most commonly what they will do is they'll put their hands inside the mouth and induce vomiting. So when they are doing this repeatedly, every day eating more and inducing vomiting, putting the hand inside the throat and inducing vomiting, so what will happen here is, the parotid gland will start getting inflammation. It will cause parotitis. So when parotitis happens, both sides of the cheeks will get swollen. So around the face on both sides of the cheek there will be swelling as shown like this in the image. So this will give them this CHIKMUNK appearance. So CHIKMUNK is nothing but it is a squirrel like animal which has swelling of it's naturally having a face where their cheeks are protruded outside as shown in this image. What I'm showing in the image is the image of a chipmunk. So the same kind of facial features will be there for a patient with bulimia who is trying to vomit, which leads to parotitis. So CHIKMUNK cheeks is commonly seen in bulimia. Number 12, Murphy's sign. So Murphy's sign is an assessment. When it is positive, it means there is cholecystitis. So what is this Murphy's sign? So Murphy's sign is when a patient is kept lied down in supine position, the assessor has to slowly press below the ribs in the right upper quadrant. So we know where the liver is. So cholecystitis is nothing but inflammation of the gallbladder. We are going to check whether there is inflammation in the gallbladder. So the patient has to be kept in supine position, and slowly we have to ask the patient to exhale and place the hands under the ribs in the right upper quadrant, and patient is exhaling, you have to press inside the ribs. So if patient is telling there is intense severe pain, which means there is cholecystitis. So positive Murphy's sign is presence of cholecystitis. Next one, exophthalmos. So the word itself tells very clearly what it is. Exo means outside, ophthalmos means eyes. So when the eyes are protruding outside, the condition is called as exophthalmos. So this is commonly seen in which condition? It is Graves' disease. So Graves' disease is another autoimmune disorder which induces hyperthyroidism. So what happens during hyperthyroidism? There becomes an inflammation of tissues around inside the eye structures. So all the tissues that are inside the eyes, around the retina, everything will start swelling. So when there is full swelling inside, there will be no place for the eyeballs. So eyeballs will start coming outside, leading to this condition called as exophthalmos. So exophthalmos is seen in Graves' disease. Number 14, olive-like mass. So olive-like mass in the stomach during assessment is the question. And the answer is pyloric stenosis. So what happens here is, during pyloric stenosis, there will be narrowing of the pyloric muscles in the stomach. So what will happen? It will become thickened and it will start blocking the food. The child will develop vomiting. So when there is excessive vomiting in the child without any reason, this assessment has to be done. And if you see in the stomach, you will find olive-like. Olive is nothing but, as I have shown in this image, it is a fruit with a round shape, oval shape. So similar kind of oval shaped mass you will find in the stomach. If that is there, it means that there is pyloric stenosis. Number 15 is pill rolling tremors. So the word itself tells pill rolling. Pill is nothing but a tablet, a round tablet. When the patient, without having anything in the hand, when he is doing a movement like as if he is rolling a pill in his hand. As shown in this video, I have demonstrated what is a pill rolling tremor. So as shown like this, they will be continuously moving this thing. This is more commonly seen in Parkinson's disease. So because during Parkinson's disease, there will be so much of movement disorders. So along with this movement disorders, this pill rolling tremors also will be present in this patient. So if they have pill rolling movement, it means they have Parkinson's disease. So Parkinson's disease is nothing but a neurodegenerative disorder that affects the movement, cognition and personality of a person. Number 16, KOPLIKS spot. The KOPLIKS spot is nothing but white spots inside the cheeks, in the buccal cavity, inside the mouth, where there will be small white spots surrounded by red or pink spots. So this occurs in a disease called measles. So if there is KOPLIKS spots inside the mouth, it can be a sign of measles. So once measles starts, within 2 to 3 days, this KOPLIKS spots will arise inside the mouth. Number 17, Gray Turner's sign. Gray Turner's sign is nothing but the presence of ecchymosis in the plank region. Plank region is nothing but the sides of your abdomen. That is where your kidneys are located or your pancreas are located. The sides, it is called as the plank. So when the plank region is decolorized, if you see bruises or if you see ecchymosis kind of picture, purplish or dark discoloration, it means it is Gray Turner's sign as shown in the image. Usually during this Gray Turner sign, another sign will also be accompanying, that is called as the Cullen's sign. Same kind of discoloration will be seen around the umbilicus. So if these two things are there, it indicates the presence of necrotizing pancreatitis, which means there is a pancreatitis and it has started necrotizing the surrounding structures. It is very fatal. Number 18, cogwheel rigidity. So before seeing this, you should know what is a cogwheel. So cogwheel is nothing but, if you open the watch, wristwatch, if you see the machine inside, you will find two wheel structures moving one around the other. So that kind of wheel setup, which I have shown in the graphics also, that is called as a cogwheel. So if you see the movement, you will see cogwheel going step by step. One roll, stop, one roll, stop. Similar kind of movement you will see when you try to move a patient's hand. So when you move them from up to down or down to up, as I have shown in the video demonstration now, it will go one step, stop,
3,
one jerky movement, again go down, one step, stop, one jerky movement. So continuously along with the movement there will be stops and jerks. This kind of movement is called as cogwheel rigidity. It is commonly seen in two conditions. Number one is Parkinson's disease. Number two is lithium toxicity. So when the lithium level in the blood is increased to greater than 2 milli equivalent per liter, it is called as lithium toxicity. It is common in patients who are receiving lithium treatment, especially BPAD. So when a patient is having BPAD and when lithium is given, it has to be clearly modified. Assessment of their movement has to be done to evaluate if the lithium levels are normal, and blood test also has to be done to evaluate their lithium levels. So cogwheel rigidity commonly seen in lithium toxicity and Parkinson's disease. The last symptom, leopard skin syndrome. So the skin will have leopard like appearance. There will be round black and brown spots on the skin. So this is commonly seen in a disease called as Noonan syndrome. So what happens here is, this is also a genetic autosomal dominant disorder. There will be presence of black and brown freckle like spots on the body, giving a leopard like appearance. So with this we come to the end of today's topic. So like this there are so many other symptoms, syndromes which are very important. So this kind of questions are very common in Norcet and Jipmer. So you have to study all special signs and symptoms and their diseases. So you also keep reading. We will also post continuously, and if you have not subscribed to the channel, kindly subscribe to the channel so that my effort reaches you on time all the time. Thank you.